Feeding is the stage when your baby is ready to take solids. There are a few things one needs to be aware as a parents that when your child is ready for taking complementary feeding. Usually the children will be ready by around 5 to 6 months of age. Although the WHO recommends that most babies should start complementary feeding after 6 months, some babies can be ready a bit early. So there are few things you can recognize when your little ones is ready to have solids. That is number one, your child or a baby should have a good head control. Means the head should be steady and it should not be wobbling. Number two, should demonstrate interest when you are eating, looking around, trying to grab your food. Number three, there is something called a tongue thrust. That should disappear. So what happens in the babies when they are very small is when you try to introduce solids, the tongue action goes in the forward direction, trying to push the food out. So that should disappear for them to successfully swallow. And that is the three important things one should notice the readiness for taking complementary feeding. Now, few top tips about how to give solids. So it goes in 3 stages. Around 6 months to 9 months, everything should be in a puree food. By 9 months, everything should be in a soft, lumpy food, hand mashed or finger food. By 1 year, your little one should be eating whatever you eat at home, that is a family diet. What to give? The baby should consist of a combination of cereals, vegetables and fruits. That is the most important thing. Introduce one food at a time. Don't introduce 2 food at a time. For example, introduce a single based grain for some days, maybe 2 or 3 days. Nothing happens, then you can mix the grain. Then subsequently, few days later, you can introduce one vegetable and subsequently add on another vegetable. Then you can use a combination of vegetable. It is important that your child has a variety of food that is in the form of cereals, vegetables and fruits. Another important thing is that initially it was thought that certain food should not be introduced early, but now the science has taught us that the earlier they introduce the variety of food, the better the tolerance and less risk of allergy. I repeat, the earlier the introduction of varieties of food, the better the tolerance and better the acceptance. Another important thing, any food you try, you have to try at least 10 times. What parents often tend to do is they give once or twice, the babies tend to not take it because it's a new taste for the baby. And then the parents think that the baby doesn't like it and they stop it. The more you try, the more the baby will accept. The more you try the variety of food under 1 year, the better the acceptance. Don't give honey till 1 year of age. No seeds to be given till the child is 2 years of age because of the risk of choking. No need to give extra salt, extra sugar. Consider iron-rich diet, which includes meat, which can be given as a broth, green leafy vegetables. These are again a rich source of iron. Don't forget to give some extra water after each solid meal so that the baby does not get constipated. If at all, if your little one under 1 year is constipated, you can think about some homemade remedies like prune fruit juice, pear juice, giving some extra added water. Make sure if you're using formula milk, you're mixing with adequate quantity of water in the right proportion. So these are some of the important things for the healthy diet in the first few months for the first 1 year of life. Thank you for watching this video.